assessment, and I'm coming into the patient's room. I'm going to go ahead and close the door and assure privacy or pull the curtain, and I'm going to go ahead and wash my hands before I introduce myself to the patient. Hello, my name is Yarissa. I'm going to be your nurse today.
I'm Chrissy.
Hi Chrissy, how are you doing today?
Good.
Good. What I'm going to do today is perform a head-to-toe assessment on you. Do you have any questions or concerns?
No.
Okay. Are you coming in today with any pain or complications that I need to be aware about? Okay. How old are you, Chrissy?
23.
Okay. And when is your date of birth?
March 14th, 1989.
Okay. All right. So this is a point in time in a hospital setting where you would go ahead and check your two patient identifiers and make sure you're doing a head-to-toe assessment on the right patient. I'm going to go ahead and take a seat and ask you a little bit about your health history, if that's okay. Can you tell me a little bit about your health history?
I have cystic fibrosis, asthma, and diabetes.
Okay. How long have you had diabetes?
For 6 years.
Okay. And how do you manage that?
I take short-term insulin, long-acting insulin. I have a diet. I work out, check my blood sugar, go to the doctor.
Good. And how do you manage your cystic fibrosis, and how long have you had it?
I've had it since I was 5, and basically I take treatments throughout the day. I do the physical therapy, I work out, I eat right, I see my doctor. Same thing as the diabetes.
Great, great. Okay, thank you for sharing that with me. As I was asking her health history, I was doing a general appearance assessment on her. I was focusing on her posture, on her mood, on her facial expressions, as well as her speech and her native language. I want to make sure that I'm able to communicate with the patient effectively. Do you have any questions before I proceed?
No.
Okay, great. I'm going to go ahead and ask you to stand up for me if you can, and walk to the table and walk back. I'm just checking your motor range of motion and see if you have any problems ambulating. Great. No pain with sitting or walking. Perfect. Okay, you can go ahead and take a seat. What I'm going to do next is I'm going to go ahead and look at your skin. Your skin is tan. It looks great. I don't see any bruising, ecchymotic areas. You look great. I'm just going to go ahead and assess. Her skin looks good. She doesn't seem dehydrated. She has good skin turgor, capillary refill. Her nails are great. Perfect. Good. You can go ahead and put your arms down for me. Next, I'm going to go ahead and look at her head. I'm checking the scalp for any bruises, lesions, rashes, anything that would indicate anything out of the ordinary. And her hair as well. Her hair is up. It looks good. It's nice. I don't see anything wrong. No lesions, no bruises. Her hair is nicely fitted to her scalp. Perfect. Okay. Next, I'm going to go ahead and move on to your face and your eyes and etc. So I'm starting off with your head. I'm looking to see if there's any symmetry. It looks great. I don't have any problems there. Okay. Any problems with your eyes? Are you colorblind at all? No. Okay. No nose, breathing, nothing. Okay. Great. I'm starting off with your eyes. I'm going to go ahead and grab a pen light. Okay, I am going to go ahead and check your views, your front 6 views, so I'm going to have you look up. I'm going to look side, look peripheral, look down, and to the left. Perfect. Now keep your eyes still for me, okay? Just going to look in. Perfect. Looking for accommodation here. Good job. Can you close your eyes for me? Okay, and open them. Perfect. So can you lift your eyebrows up? Perfect. All right, I'm just going to go ahead and feel your sinuses here and percuss. Good. Put your nose up for me. Just looking for patency. Good. You don't have any problems breathing. You indicated. Okay. Can you smile with your mouth closed? Okay. Now show me your teeth. Good. And puff out your cheeks. Perfect. Perfect. Okay. I'm just going to take a look at your ears. Make sure there's nothing in the canal. Perfect. You don't have any hearing impairment?
No.
Okay, good. So next I'm going to move down to the neck. And what I'm going to do with the neck is I'm just going to go ahead and inspect and make sure I don't see any pulsating in the carotid area. There's no neck distension. So I'm going to go ahead and feel for the lymph nodes. I'm comparing one side to the other. Gentle pressure. Okay. And now I'm just going to take a feel feel to the carotid pulse. Not applying too much pressure. And I'm going to go ahead and auscultate and make sure I don't hear any breeze, which would indicate a blockage. Okay, perfect. Okay, so we're done with the neck area. We're going to go ahead and move to the chest down, okay? I'm going to start with the heart, and we're going to go ahead and I'm going to listen to the apical and the radial for a minute each and compare them and make sure there's no difference. I'm starting with the apical. Radial. Okay, perfect. And I'm going to take a listen to the areas of the heart individually, okay? I'm starting off with the aortic. Moving to the palmolic. To the tricuspid. And to the mitral. Perfect. Okay. Your heart sounded fine. You had S1, S2, which is a normal rhythm and rate heart. Your heart rate before we took blood pressure vitals, her blood pressure was 118/72. Her heart rate was 72 with a normal sinus rhythm. Her temperature was 98.4 and her respirations were 18. Everything was within normal limits, okay? And going back to that as well, we did take measurements on her. Her height was 5'3", 63 inches. Her weight was 118, and that would give her a BMI of 21, which is within normal limits. Again, no obesity or overweight for her. She also had a waist circumference of 24, which is within normal limits for females. We are going to go back to the chest area. Is there anything in the chest area that I need to be aware of?
And the metaport.
Okay. I just want you to look at the metaport on the right upper chest. It's not accessed. How long have you had the metaport?
A year.
Okay. I'm going to go ahead and stay away from the metaport. That is her lifeline, so I don't want to deal with that. I am going to go ahead and percuss the back and listen to the front. So if you can go ahead and take a seat for me, I'll percuss the back. Can you turn that way for me? Thank you. I'm just percussing the lung field. Any pain?
No.
Okay. I am going to take a listen to the lung fields in the back, comparing both sides. Deep breath. And your lungs sound great. Deep breath. Okay, perfect. You can turn towards me, please. I'm just going to take a listen to the front. Deep breath. Great. Okay, perfect. Your lungs sound really good. So I'm going to go ahead and move along to the abdomen area. If you can lay down for me, please. Do you have any pain in your abdomen at this time?
No.
Okay. I'm just going to go ahead and inspect if I can. And I'm just going to look for any pulsating hernia. Sit up for me just a little bit. Perfect. There's nothing protruding. Okay, good. I'm just going to take a listen. When was your last bowel movement?
Yesterday.
Okay. Making sure she has vowel sounds in every quadrant. Now I'm just going to do a percussion on this area as well. And then we're going to do a light palpation. Any pain?
No.
Okay. chest area. She is a female, so one thing that females do have to remind themselves is to do a monthly breast exam, usually around the same time of their period. Do you do a monthly breast exam? Perfect. And basically you just lift up your arm and kind of palpate in a circular motion. So that's something that you always want to make sure your female patients remember. Okay, we talked about her bowels. Do you have any problems with your urinary tract, voiding, anything like that? Another thing is you want to make sure you follow up with the OBGYN yearly and follow up and make sure you get that yearly pap smear. We're going to move down and finish her cardiovascular with her pulses on her feet. There is no edema on her legs. And she has good palpable pulses. No leg swelling. Push your feet up. Good. Okay, that's perfect. Now go ahead and take another seat over here for me and scroll over. I'm just going to do a little strength test. Put your arms and push down on my arms. Good. Turn them over. Hold them up. Good. Now. Push down. Good. Good. All right. You can put your arms down. Push down against my legs. Perfect. Now now push them back against mine. Perfect. All right. Great. And that concludes our head to toe assessment.